Hey everyone, welcome back to another episode of Doctors Go Live with me, Nina Sharil Khan, your host for Doctors Go Live. And today we are going to be talking about kidney health for all. Now, let us know if you're tuning in, where you are tuning in right now, and how are you guys doing? And of course, what would you like to learn in today's episode? Kidney health for all and awareness education. Okay. Now, if you share this video out as usual, you will get to take part in our Doctors Go Live quiz happening right at the end of the Q&A, where you get to win. Today, it's about lunch boxes. Okay, so you get to win lunch boxes. So all this happening right here on Doctors Go Live with me, Nina, and our special guest for today, Dr. T. Kalaiselvam Thevandran, consultant internal medicine physician and nephrologist. I hope I'm pronouncing it right, from Columbia Asia Hospital, Klang. Now, your kidneys are vital organs. What does that mean? What it means is that we cannot survive without our kidneys. So to better understand what our kidneys do, what happens if they stop working, and how we can keep our kidneys healthy, today we're going to go look into all this and so much more happening right now on Doctors Go Live. All right. Let me know if you're tuning in. Would love to hear from you. Now, if you know someone who will find this information super useful, or if you think this is such an important topic to share and is going to make a difference to someone out there, then please do share this video out, tag your friends, share it out on social media, and follow us on our social pages, because this episode is definitely going to make a difference in their lives today. All right, so let's take a look at this video.
Your kidneys are vital organs. This means you cannot survive without them. To learn more about your kidneys, join Dr. T. Kalaiselvam Thevandran, consultant internal medicine physician and nephrologist from Columbia Asia Hospital, Klang, on the next episode of Doctors Go Live. He will be talking about kidney health for all and awareness education. Happening on Thursday, the 17th of March at 3 p.m.
Welcome back, ladies and gentlemen, to Doctors Go Live, and today we are talking about kidney health for all and awareness education. Pretty serious video there. I thought, I was like, oh my goodness, I think I might be suffering from kidney health disease or something, but then they said poor appetite, so maybe not. I still got my appetite. So anyway, your kidneys work very hard. Every 30 minutes, they filter out blood to remove waste, poison, and excess fluid from your body. Now, it also does many other important jobs, including help to control our blood pressure and keep our bones healthy. Okay, so here to help us understand about our kidney health, we've got you our expert from Columbia Asia Hospital, Klang, Dr. T. Kalaiselvam Thevandran, consultant internal medicine physician and nephrologist. Dr. Kalai, thank you for joining us.
Yep. Nice.
Okay. Nice meeting you too. Is it right? Nephrologist? Is that how I pronounce it? Hi, Fami.
You're absolutely right. Nephrologist.
Okay, got it. Sounds almost like an Egyptian word, like Nefertiti there. Okay, but never mind. I learned a new word. Also, right at the end of the show, we have our Doctors Go Live quiz. So don't go anywhere. We've got some lunch boxes up for grabs. So do listen up to Dr. Kalai. Do I call you Dr. T? Which one?
Dr. Kalai.
Dr. Kalai. Okay, cool. I think rapper name Dr. T lah later if you intend to be a rapper. So if you have any questions, feel free to ask us in the chat and we will address them right at the end of the session. Okay, Dr. Kalai, first things first, could you share with us a little bit about yourself, how you got started doing what you do, and what is a nephrologist? Yeah, and how did you get into it?
Yeah, I'm actually a consultant here in Columbia, Klang, working as a physician and as well as nephrologist. Now, it's all started with a intricate patient that I want to go into something which is quite complex, and I find that kidney disorders is very interesting, very complex, and very much well connected kind of a thing with other organs. So when I become a doctor, I thought this is probably a good for me to learn human body, and one of the way for me to go into is looking into kidneys and see how much is this organ, which is very precious, that we all taking it for an advantage. We never thought that is doing a lot of things on the back door of us. It's such a vital organ.
Wow. So it could easily be overworked, huh? Because it's doing a lot of functions. Wow, amazing. Okay, cool. So Dr. Kalai, before we start, to make sure everyone is on the same page. So first things first, can you help share with us about our kidney? What is the function of the kidneys?
Right now, we all know kidney is a pair of bean-shaped organs, which is I think you can see there's actually a model a bean-shaped kidneys at the both side of our spine, below our rib, and it's actually at the back of our belly, right? It's situated at the back of our belly. It measures about 4 to 5 inches, and it's if you were to compare, it's probably a large size of a fish. Yeah, so that's what is the kidney, and you can see that's it's as what you mentioned. It's the main function is to filter the body blood, and it's excretes waste. So blood goes into the kidneys, and it will be filtered along the way with multiple filters, which what you can see here, which we call it as a glomerulus, is a filter where you can see the blood going in, get filtered, and eventually comes out as from the tubules, and that will be collected at the kidney pelvis, which is situated in the kidney, and will be going. The waste product is what we call as urine. Will be going through a tube. That what we call as urethra, going to the bladder. So that is what the kidney function as for filter and whatnot. But mind you, it is the function is not only to filter. It has more than that, like what you mentioned, bone health, blood pressure control. It keeps the red blood cell packed, and also keep adequate restored red blood cells, electrolytes. Yeah. So it's a very vital organ. Keep the entire environment in our body at a check.
Okay, fantastic. So why is it so yes, it's a vital organ. Why is it so important to understand kidney health? What's happening today?
Right now,
Yeah.
we have actually, as I mentioned to you, is a vital organ.
Mm-hmm.
We know that even every times our blood pumps is about 20% of our blood flow straight goes to the kidney and get filters. And every day we have about each blood going around about 40 times going to the kidney kind of a thing and get filtered and refined and going back as a clean blood kind of a thing. So it's so important that that it has been functioning in our body, but many of our the way that we have lived that goes into other kind of damages, which we never know until it's late. That's what we call kidney disease, especially the end stage. It's a silent killer. It's a disease of very silent that doesn't show itself.
Mm-hmm.
Yeah.
Wow. So you don't see it until it's at the end stage. Okay. So is this what you call CKD? And how common is it in the world in Malaysia?
Okay. Now let me be very clear. Chronic kidney disease is actually the disease process, which is gradual, which is happening in the kidney kind of a thing. And it goes into the advanced form of it, which what we call as end stage renal disease. the extreme, the latest part, that what we all know as kidney failure. So chronic kidney disease is a disease of the kidney which happens, and we have about 5 stages of these kidney diseases. And
Mm-hmm.
the last part, the kidney failure, is actually the stage 5.
Mm-hmm.
So yeah. So how common it is in Malaysia? It's about 13%. Um,
13
uh,
eh? 13.
the last
Okay.
that is that is 2018 kind of a record. Earlier it was 2011. It was about 9%,
Mm-hmm.
and worldwide it's about 10% or so. Um, Very difficult for us to actually get the actual number of this chronic kidney disease because
Mm-hmm.
it varies with countries and how it is measured kind of a thing. And as I mentioned to you, the chronic kidney disease, the end stage part, is only about 0.1% of the world population. And even in Malaysia, it's probably about 0.1 to 0.3% of all the prevalence. So it is actually the end stage, what we saw, what we are seeing patients going on dialysis kind of a thing, is probably a tip of iceberg as compared to the 90% or so all we don't even know that they are having this chronic kidney disease.
Because there's you can't tell
This is
until it's late, right? I guess.
yes,
Wow, this is big. Okay, I get it now. Okay, so why does it happen, and who does it commonly affect?
right. Now let me share with you. I think this is a lifestyle disease.
Uh-huh.
We know
So
that
it's like
no
diabetes.
diabetes,
Mm-hmm.
hypertension, those who are at risk, those who are like even smoking, obesity, especially in Malaysia, we are seeing the trend that
Mm-hmm.
that that quite common in the later years. We are seeing
Mm-hmm.
the diabetes, hypertension, and those increase into obesity, and especially increasing advancing age. These are actually quite common to go into chronic kidney disease kind of a thing. And those lifestyle habits like smoking, alcohol intakes, excessive, and especially a sedentary lifestyle.
Mm-hmm.
There are few kind of risk factors. Obviously, on the kidney perspective itself, if there is actually a structural diseases, something abnormal in the kidney structure itself, that can also go into predispose into CKD and as well
Mm-hmm.
into end-stage renal disease. Yeah.
I see. Okay. So would you say that food as well plays a part? What we intake?
Oh yes,
It's-
oh yes.
Okay.
As I mentioned to you, the food is how we are is closely related to obesity, closely related to hypertension, closely related to all these non-communicable diseases, kind of a thing. So
Mhm.
obviously, it is food is definitely has a vital role there.
Okay, got it. Okay, cool. Now, going back to what you said, you mentioned that by the time it's detected, it's usually at a really late stage, right? So, speaking of that, when can we detect chronic kidney disease? What are the warning signs, if there's any?
Yeah, this is very relevant because we know that it's a silent disease. With the most of the symptoms tend to happen at the later part of the disease. So, what are the early signs that you can
Mhm.
actually figure it out? Probably it's more on the urine. If you notice that some frothy urine, some form of a bubble, abnormal kind of a thing that you need to flush like 1 or 2 times, then you know that no something is not right. That you need to go and see the doctor. And how do we go and check it out? Probably the doctor will do the urine test, blood test, and in fact some form of imaging, ultrasound or CT scan to look into the structure. And these are probably things that you can pick it up as early warning symptoms. Abnormal urine, it can start from there. Some people will have some bloody urine. and there you can actually pick it up. Something is not right. Then you can actually go and have a proper checks. Yeah. So yeah, and especially if you have comorbids, meaning that you have any form of diseases like diabetes, hypertension, any form of ischemic heart disease, and your family is at risk of having any form of kidney disease kind of thing. These are
Mm-hmm.
probably some of the risk factors that you
Mm-hmm.
tend to see that you should be checking your kidneys probably as annual at least.
Mm-hmm.
Mm.
Right. So it also makes sense that we don't wait for these warning signs
Yeah,
from our urine. We go for regular checks, which
yeah,
once a year. Is that good?
yeah. That's probably is an annual check. But if you
Mm-hmm.
have diseases, comorbidity,
Mm-hmm.
probably more timely
Mm-hmm.
manner. I think your doctors will do as timely manner kind of assessment on your kidneys and whatnot. At least a
Oh.
urine check is also a blood check. Now,
Mm-hmm.
coming back to your symptoms, I forgotten to
Mm-hmm.
ask you. Now,
Uh-huh.
there are two symptoms which I would just want to share. This is
Mm-hmm.
actually a nice brochure talking about signs and symptoms of kidney diseases. Now, number
Mm-hmm.
one, you can see some form of blood in the urine.
Mm-hmm.
Sometimes people tend to have urinations initially, then subsequently at night,
Mm-hmm.
and high blood pressure. The
Mm-hmm.
blood pressure can go up high. That's probably one of the indication that whether the kidney is going off with. And foamy urine is what I mentioned, frothy
Mm-hmm.
urine, because of the protein in the urine. And some people have some form of a swollen on the legs, ankles, feet, and also
Mm-hmm.
puffy eyes.
Mm-hmm.
And some people will have very tired, kind of lethargy kind of a thing. And some people with advanced kidney disease, they can also have nausea, vomiting, appetites are
Mm-hmm.
low, and itchiness as well. Yeah.
Itchiness. Okay.
Yeah. So these are probably some sign which can happen along the way, but don't wait until things go in a
Mm-hmm.
very bad condition. Blood pressure, yes, a few things for you to keep track. Urine abnormalities, these are quite
Mm-hmm.
important. And abnormal form of urinations, you also can
Mm-hmm.
actually in the early form. Yeah.
Doc, with all these symptoms that you're sharing, if we're able to detect it and by the time we go and have it checked, is that still considered early or is that too late already?
Okay.
With the yeah.
We wouldn't know because, as I mentioned, that it can be a silent disease kind of kind of a condition. So by the time that we would have picked up, you wouldn't know. It could be an early form, or it could be an early later part. As I mentioned,
Mm-hmm.
um, um, these are probably the stages now, the stages of the kidney disease. So
Mm-hmm.
we have 5 stages
Mm-hmm.
down,
Mm-hmm.
and we have the amount of protein leakage. So the first symptoms, even as a normal person, we might not even have, even in the CKD stage one, we would have been surprised that there's no even much of protein kind of a thing. So
Mm-hmm.
it is protein is definitely good for you to pick it up, especially if there's the urines are very foamy kind of a thing.
Mm-hmm.
Uh, but that foamy, if getting more and more, then it can progress to uh, further diseases. To answer
I
you,
see. Mm-hmm.
whether is it going to be an early kind of a detention or later kind of a detention, depends on when you pick it up and when you actually go to the doctor. Yeah.
Okay, got it. So I think to be safe, I think just go for regular yearly checkups, right?
That would be quite a good. Uh,
That would be the best, right?
yeah.
How old should people start?
Maybe
30 and above?
30 years, 40
Mm-hmm.
also a good point. 50
Okay.
years old and above, if there's
Is
strong family member, and if you have diseases, you may want to. The doctors would definitely would go through this
okay.
check. Yeah.
Okay, got it. So I think to be safe, 13 and above, go for yearly checkup. Okay, easier, easier. Okay, so once let's say we find out we have it, what is the treatment, or what are the options for somebody with CKD?
Right. Now, as I mentioned to you, 5 stages of CKD is there.
Mm-hmm.
We can group it into a mild to moderate, which is early form of CKD,
Mm-hmm.
versus advanced, which is like CKD stage 4 or
Mm-hmm.
5. Right now, in an early form of CKD, chronic kidney disease, the management is definitely got to do with reversing and try to treat the underlying medical problems and try
Mm-hmm.
to avoid the common factors, the common um, um, disease outcome, which is very much not the kidney in an earlier phase, is more on the heart.
More on the
So
what? Sorry.
the heart, the cardiovascular. So
Ah,
the
okay.
disease management would be a lot to do with managing the underlying problems and preventing heart disease. These are the
Mm.
people in an early stage of kidney disease. They will well-known studies have quoted they succumb not because of the kidney problem, but because of cardiovascular diseases, heart-related problems. So they are at the high risk of going into heart diseases. That
I
is probably the
see.
earlier, management.
Uh-huh.
Later
So there's
part,
a
yes,
strong correlation there, right? I
yes,
suppose it makes sense because it is lifestyle, right? So what we put in our mouth, in our lifestyle is as well. Okay, got it, got it.
yeah. The later part, yes. When it comes to advanced kidney diseases, stage 4, stage 5 kind of a thing,
Mhm.
then we're going to go into more care on the kidney. And of course, we're going to have some kidney complications setting in. Then the disease managements are actually towards kidney problem itself. And on the later part, at advanced end stage, then we are going to talk about renal replacement therapy. That's where the dialysis and whatnot. Yeah.
I see. Speaking of dialysis, will I eventually need dialysis? And if so, what is the timeline we're talking about?
Right. Now,
Mm-hmm.
quite a difficult kind of a question
Mm-hmm.
because I think it varies with where do you stand. If you are at the early diseases, it all depends on how much leakage of the proteins. And if your kidney is leaking more protein, like no, you can see even on the first stage, if you are leaking more protein, which is going towards the yellow line kind of a thing, you tend to have high risk of progressing as compared to the later part of the diseases where you have more and more leakage of the proteins, then you
Mm-hmm.
tend to be progressing it more. Yeah. So it depends on where is your kidney stage
Mm-hmm.
and how much of protein leakage you are and how disease your comorbidity is it well controlled or not well controlled.
I see. So it really depends on the stage where you're at, lah.
Yes.
Is it okay? So which goes back to another of my question. Is CKD preventable? Is it curable, or is it a death sentence? I think I kind of know, but I'd rather hear from the expert.
Yeah. Now, it's definitely what you call a preventable disease. Yeah. So we can take care of our kidney. It's not a life or death sentence. It's probably how I see this. It's probably a warning sign that no, look, the body is telling, look, take care of yourself more. And how do you keep yourself? How do you keep your kidney more healthy? I would say is lifestyle measures like eating the right food, healthy food, doing a lot of physical activities, um, getting your weight checked, not going more gaining weight kind of thing. Get good sleep, yeah, and stop smoking, and obviously if you're drinking alcohol kind of thing, limit your alcohol intakes and get your diseases under control, especially blood pressure, especially high blood pressure and diabetes. Yeah, so these are a few things which we should be doing. It's more on the lifestyle that we want to target it. and avoiding all this nephrotoxin. Nephrotoxin is something which is harmful for the kidneys. Things like painkillers, things like over-the-counter medications, some form of supplements, which we don't know what is the content, herbals, traditionals. These are delicate things which is well, um, well. Is a lot there outside, and we tend to see and buy because of recommendations, kind of a thing. It's time for us to see what is the content. Is it harmful for the kidneys? And the best thing is go and get yourself checked and see the doctor. Know if you have all the risk factors.
Okay, I think that's really beautiful how you say it. It's not a death sentence. It's a warning sign, from the universe or from anywhere that, hey, you got to look in and start taking care of yourself better. I think that's fantastic advice. There's some questions coming in. If you have any questions, please let us know. Type it in the chat, and we're going to get our expert, Dr. Kalai, to answer it. Yeah. So, Doc, what about for pregnant women? What are the risks for pregnant women who's going through dialysis? Does that happen? I'm sure it does, right?
Yeah, yep. Yeah, women. This is talking about pregnancy and dialysis. Talking about patients who are going through dialysis, kind of a thing. Can women at the fertile age, can they get pregnant or not? Most of the times we tend to see they have some form of even more than 90% that we tend to see the dialysis patients, young women, don't produce LTHs. The ovums are not healthy to be fertilized, to have baby form. So that is one thing, and they do have some other issues like having irregular menses and also irregular hormones, kind of a thing, and that puts them into not very favoring conditions to get pregnant. But they do have some cases when we do see pregnancy among young dialysis patients, women. So but that becomes as high risk patients. Yeah. Why is high risk? Because about 20% of them they go into miscarriages as early kind of pregnancy, and about almost 80% of these pregnant women mothers they don't go and complete their full-term pregnancy. They tend to deliver earlier. So that is very high risk pregnancy that we don't encourage them to get pregnant. And not only that, there are a few environmental factors. The dialysis patients tend to have high urea toxins, kind of a thing, which is may not be favoring for the fetal growth. So many of the babies which is born tend to be small, retarded, kind of a thing. So so we tend to do a lot of measures where we have to give them close to our loop, doing regular. If normal person uses needs about 3 times per week dialysis, for pregnant women we may need to give more, about easily 5 times per week, kind of a dialysis, to make sure the urea toxins are all in
Finalized out. Okay.
yes, friendly for the baby growth, kind of a thing. And it's going to be a lot of multidisciplinary kind of management. The gynae doctors have to be monitoring them, seeing the growth, and even pediatricians have to come in earlier to manage the baby. Regular scans, kind of a thing. So it's very much detailed, very much kind of a high pregnancy, high risk pregnancy that we have to alert.
Okay. Wow. So it sounds high risk, but it does happen. Yeah, it does happen. So just be aware about it. What about COVID-19? If I have COVID-19, Does it cause kidney failure in otherwise healthy adults? Just wondering.
Yeah. Now, COVID has gone into few phases. We have gone through there. In an earlier time, we have seen especially severe COVID, about 30% of them, they go into having some kidney issues kind of a thing. And especially like 50%, those who are admitted in ICU in early days, they go into having dialysis. But as we have seen the phases of COVID, better treatments, vaccinations kind of a thing, and we are seeing the numbers are getting lesser. And why does COVID patient gets kidney problems? There are a few theories which talks about this COVID and kidney. Number one, whether this is a direct COVID infections on the kidney. Yes, that's actually one of the thought. Number two, it can be because of the oxygenation. You tend to know we are quite clear that COVID causes hypoxemia, low oxygen level, and that actually can lead to oxygenations low even to the kidney. So that is actually one of the theory, the thought. And obviously, I think there's one of the issues about COVID. It is an infection which causes a lot of reactions, body immune reactions, which can lead to a lot of cytokines. Cytokines are actually some form of body immune reactions that goes into rush, a big amount of rush in a COVID patients. So when they go into very high amount of immune reactions, that goes into favoring the body immune towards the infections, but also some form it causes damages to other organs, especially to the kidneys. So that is the number three thought, whether this is actually body immune reactions towards infections leading to kidney problems. And obviously, number four, I think also studies have quoted that COVID does cause a lot of clotting issues, blood clotting issues, and some micro clottings does happen and also can lead to kidney problems. Things are getting a bit more better now.
Right. Okay. Okay, got it. So it does basically, it used to cause more havoc, I guess, but now less with better management and care of COVID-19. Okay, fantastic. Let's go into the Q&A section, yeah? Are you ready, Doc?
Yeah, okay.
Okay, so let's take a look at Siti Akila. Her question is, what are the best on-the-go snacks for CKD patients?
Snacks. Okay, you have to be very careful because snacks, it can be either to put it low salt, low sugar. If you have diseases as it is, we do have two form of salt. As what we all know, the common one is what we can see. That is the common salt, the cooking salt kind of a thing. And even in the shops where salt we can see like mama and whatnot. So these are the common salt which can be added on the common food, snacks kind of a thing. Now there are also another type of salt which we don't see, especially those coming from seasoning. Yeah, things like Ajinomoto. Sorry, I shouldn't be saying the name. Is preservative that contains like 3 times of salt content. Things like oyster sauce is about 3 times of salt content. Salted soy sauce is about 6 times of salt content. Even fish sauce that we do soups and whatnot. So that contains about like 9 times of salt content. So we should be able to probably know what is the ingredients. If you can know about these snacking things, whether this is a healthy snacks, low salt, low sugar, and very much high fiber, the kind of things.
Okay, got it. So stay away from the salt, basically. and healthy snacks. I suppose it's the same kind of recommendation for people with heart and diabetes kind of snacks.
Yes.
Okay, got it. So next question that comes from Janet is, hi doc, is it normal to constantly go to toilet at night during sleepy? I suppose it's during nighttime. Great question, Janet.
Yeah, very good question, Janet.
Mm.
There are two things which runs in my mind about night passing urine, nocturia, we call it. Now, it means your body can't conserve the urine, so it need to go to pee. So why things happen this way? Now, number one, common diseases like diabetes that can actually cause you to have nocturia. Another one more thing is like CKD, chronic kidney disease itself. When we tend to have a loss of the kidney filters, then you tend to leak more. You tend to be not conserving this kind of urine, and your bladder tend to be full most of the times at night. So that's why I think you tend to pass more urine at night. And obviously there are other hormonal factors and whatnot. I think whether this is bladder incontinence that can be dealt with urologists kind of thing. So this is basically you can't conserve the urine, and there could be a bladder incontinence issues. Yeah.
So what's the best thing? Go in
Yeah.
and have a check.
Yeah, better go
Okay.
and have a check. At least you are you having any form of diabetes? Do you have any kidney disorders? Is your kidney structure is okay or not? These are
Things to look into. Okay, got it. Lorraine Yit has a question, and her question is, hi doc, what is the most common symptoms to look out to look out if a person has kidney problem? I think you shared, but let's recap it for everybody who's tuning in. Is that okay, doc?
yeah. Most common, if you ask me, I think it doesn't come as universal. Some people will have some other symptoms, like what I do mention earlier, urine abnormalities in terms of passing more foamy urine, blood in the urine, even the frequency tend to be a bit off. That can be the earlier sign which we tend to see in the earlier time. But some people do have things like high blood pressure, and that when we had a check on the kidney, that can be also be found. So yeah, so these are the few other symptoms which we tend to see. Even things like itchiness, dry skin, swollen on the limbs and on the eyes. These are also some of the symptoms we tend to see in the later part. Nausea, vomiting. That happens especially if you have high urea, high toxins build up in the body.
Okay. Is it possible to not have certain symptoms, but other symptoms as well
Yes,
that you mentioned? Okay, very possible. And could I actually be having kidney disease and not have any of the symptoms as well?
Yes, there is possible, but again, if especially if you have a high risk of, diseases or any form of diabetes, hypertension, or any family member with any form of kidney disorders, even any form of structural problems, we tend not to see much. It becomes very silo and very silent.
Right.
Yeah.
Okay. Okay, got it. So one more question before we go into the quiz. Sakina is asking, is it okay to have one kidney? Won't it get overworked? Because some people donate their one kidney. That's a very good question.
Yeah. Thanks, Akina. I think yes. If you ask me, staying with one kidney is entirely alright. Especially we have seen people who have given their one kidney and live with it, and they don't go into progressive kind of kidney problems and go into dialysis. So having one kidney, which is functionally good, is still good to keep you alive without having any form of kidney end stage kind of a problem. So one kidney is still alright. But if your second thought question, whether is it going to be overworked, yes, it can complement the other kidney function. So we do have two kidneys which functions as 50-50 kind of a thing. If you have one kidney, so the kidney may took up more work to complement on the other side. So there is a possibility that it can overwork. Yeah. So if you have one single functioning kidney, you should be on regular follow-up because you wouldn't know whether the kidney is overworking and then is tiring up and it goes into more kidney problems at a later age.
Okay, you mentioned if you have one regular working kidney, we should be on what? Sorry, I couldn't hear it just now.
At least a medical follow-up, a kidney doctor's follow-up.
Okay. So you should.
Yeah.
Okay, got it. So you should definitely be connected to a doctor and follow-ups kind of thing. Okay, got it. So let's go into some to the quiz section. Yeah, fantastic. Keep the questions coming so we can answer it while we're waiting for the answers for the quiz. Yeah. Okay. So, all right. Right now, before we continue the Q&A, we've got some awesome stuff for you guys up for grabs, and it is lunch boxes today. That's right. It's quiz time, and as mentioned at the earlier part of the show, there are 3 lunch boxes up for grabs. Now, what do you need to do to win? First, you got to be sure to share this video out to at least 3 times. Okay, share it out at least 3 times, and remember to set the post share to public so that everybody can see it. And next, you answer the next 3 questions that we'll be showing on the screen in a single comment. And you're on your way to win the prizes. All right, let me repeat that. First, share this video out 3 times. Remember to set the post to public so that everybody can see this. Secondly, answer the 3 questions we are about to show you on the screen in a single comment, and we will select the first 3 winners based on speed, the correct answers, and shared posts. Are you ready? If you are, let me know in the comment section. Okay? All right, let's go. Okay, first question. Shall we have it? The only purpose of the kidneys is to filter blood. True or false? Question 1. The only purpose of the kidneys is to filter blood. Is it true or false? Question number 2. A person can have chronic kidney disease without any symptoms. Is that true or false? A person can have chronic kidney disease without any symptoms. True or false? And the final question is, hemodialysis is the only treatment for kidney failure. Is that true or false? Hemodialysis is the only treatment for kidney failure. Is that true or false? Get those answers coming in, and then we're going to see who's going to be the winner. Okay? While waiting, let's go back to the Q&A, shall we? Okay, so that was loud. Okay, so the next question comes from Combs. I think this is a fantastic question. Thanks, Combs. Combs Sashwan. And her question is, hi, Doc, can dialysis kidney failure be also a genetic factor?
Yeah, certain diseases. Thanks a lot for this question. Kidney failure, with genetic, yes, certain condition which can cause you to have damages into your filters. That can be genetic influence. So the answer is yes. Certain diseases which has which leads to kidney filters, glomerular nephritis. Yeah. So then we tend to see whether there's actually any genetic predispositions or not.
Okay. How many percent do you know the ones that's genetic related, out of curiosity? Just wondering. Do we have data on that?
Small percentage, is not so high. The
common so it's more lifestyle.
Yes, common is still common lifestyle diseases.
That's a relief to hear, yeah? Kind of thing. All right, so Muhammad Yazid has another question. His question is it true that if we practice a protein diet, it will lead to kidney problems? Such a great question, Yazid. I would love to know as well, because, people are talking about this Atkins diet, keto diet. Does that put a strain on our kidneys?
Right. Now, if you ask me, yes. especially those who are taking lots of protein, like bodybuilders, kind of a thing. They tend to have lots of protein, which has been filters, and eventually we have these conditions called um, big glomerulus, and that can actually lead to fibrosis, scarring kind of conditions, especially those who are taking high loads of proteins. Keto diets and those who are on DASH diets, kind of a thing. That that's a bit subjective. I would say, if you are on all these diets, you should be getting your doctors to consult with them on a timely manner, see whether is there any effect on the kidneys or not. So then you know that you are on the right track or not. Yeah.
I see. I think that's very, very good advice because we don't know on this all these new diets keep coming in and we don't have the data, right? So the best thing is to have that conversation with a doctor. Kind of thing. I'm seeing some of your answers. Combs, you are so cute. I think Combs gave different multiple versions of answers. So it's almost like main tikam, huh? So well done, Combs. Cecilia has a question. When do kidney patients need to start dialysis?
All right. Cecilia, thanks a lot for your question. I think kidney patients or chronic kidney disease, as I mentioned to you, especially in an advanced stage, stage 5 and below, that's where we call it kidney failure. These are when your kidney function is less than 15% or so. Then these are the patients needs dialysis. Dialysis is one part of renal replacement therapy. So it's not really an entire treatment option. There are other options like renal transplant that we can do. Dialysis, we have two types: blood dialysis, or what we call as hemodialysis, and there's also another one more form which is called peritoneal dialysis, or commonly well known as water dialysis.
Got it. Okay. So one last question. I think Bo Martin has a question. Once on CAPD, peritoneal dialysis, with no transplant, what could be an expected life expectancy? Wow. Okay. Doc, maybe you can share a little bit of a background about this question. Some people might not even understand this.
Okay. Now we have seen some people doing very well with CAPD, right? Peritoneal dialysis, kind of a thing. We are talking about how long you can actually pursue a form of dialysis. It's interchangeable. A kidney failure patient may start with peritoneal dialysis, and after the filter means our own peritoneum gets weaned off, or for some reason you need to change to hemodialysis, changing dialysis mode. We tend to see that happen quite common. Yeah. So if you ask me when it's going to be a life expectations for PD peritoneal dialysis patients, I would say it's not a death sentences. You can live long from one mode of dialysis, going to another mode of dialysis, and eventually going back to around. So I've I've even seen PD patients living as long with peritoneal dialysis as long as 15 years. That is on one mode. But life expectation could be a different kind of scenario where it goes across dialysis mode. So it can go from peritoneal dialysis to blood dialysis, and can even come back to peritoneal dialysis and whatnot. So it's difficult to give an answer of a life expectation.
Wow.
Yeah.
Okay. Okay, cool. So I think that's wonderful news because, I think we all want to be hopeful, right? The way it sounds. Okay, fantastic. We have our winners. But before I announce our winners, I hope you can hear me in between the lightning. All right, so before I announce our winners, Let's find out what the correct answers are, because you guys are so cute. There's so many of you guys. There's a few of you. Combs, Jasmine, even you're giving me different combinations of answers. I think the third one really threw everybody off. All right. So the first question is, the only purpose of the kidneys is to filter out blood. The answer is false, right? A person can have chronic kidney disease without any symptoms. True or false, Doc?
True.
Okay. Hemodialysis, yeah, as for what you shared, right? There's so many times where we don't see the symptoms. And hemodialysis is the only treatment for kidney failure. True or false, Doc?
False. Because as I mentioned to you, got other modalities. Water dialysis, peritoneal dialysis is what was one of the question mentioned. And renal transplant is another mode. Yeah.
Fantastic. So it is false, true, false, right? So the winners are Bo Martin, Mary Hannah Jochebed, and Jasmine Liu. Congratulations to our winners. Congratulations, everyone. Okay. Combs, I think you have to reply faster with the right answer. Okay. That's all it takes. Thank you so much. So for our winners, congratulations. We will be contacting you right after this within 1 day to get your details. So be sure to check your Facebook Messenger inbox, okay? Because we're going to reach out to you. Congratulations, Bo, Jasmine, and Mary Hannah. Okay. Now, before we go off, Doc, today has been really insightful. What are some of the things that you guys have learned and picked up from today's episode? Let us know in the comment section. But before we go off, Doc, could you quickly summarize for us, in your experience, what are the most common mistakes people make when it comes to dealing with kidney health or even CKD?
Right. Now, we know that it is a silent disease. And many people, even when we have chronic kidney diseases, when we are talking about it's a lifestyle diseases, it got to do a lot with our lifestyle, the food type, salt intake, the sugar intakes, and especially getting your diseases under control. These are few things which people tend to overlook. And obviously, I think healthy lifestyle means even exercises. You have to do at least 30 minutes per day and about 5 times per week. These are few things which people tend to overlook kind of a thing. Another one more thing is a lot of over-the-counter medications. We tend to buy even supplements, herbals, some nephrotoxin, some are harmful for your kidneys, and we overlook into it in the name of we want to get well, we want to do something good for ourselves, but it could be a harmful thing that we are causing our own self.
Right. Okay. Thank you for that. I think I could be guilty of that. These over-counter medicines, we don't think about it, and then it affects our kidney, right? And last tip, Doc. If you had 3 tips to give to people out there about kidney health, what would it be?
Right.
3 only.
Okay. Healthy lifestyle.
Healthy lifestyle. Okay, got it.
Keep yourself well hydrated.
Okay.
Drink good amount of water. Avoid nephrotoxins. Yeah, things which is not good for harmful for your kidneys. Avoid it. Over-the-counter medications, herbal supplements, kind of a thing. And go through your ingredients and to see careful about what you're gonna eat and whatnot. Snacking. Yeah. So this is avoiding the nephrotoxin. And final one tips probably.
Bonus tip.
Doctors. Yeah, go and check.
What,
go and check with your doctors.
Right? Okay, the regular check thing. Okay, yes. Fantastic. Yeah, I think that's brilliant. So if there's anything that I learned from today's episode is that, you might not even have symptoms. By the time you realize you have chronic kidney disease, it's a lifestyle thing, and check your over-the-counter medicines and go for regular checkups. That's my biggest learning. Jasmine is sharing that jaga our kidney bye-bye. I think that's a brilliant share. So thank you so much. What else did you learn? Let me know in the comment section. But thank you, ladies and gentlemen. Today has been a super insightful session. Thank you, Dr. Kalai. absolutely useful. I've definitely learned a lot. Also, we have great news to share, right? Dr. Kalai, Columbia Asia Hospital Klang, where you are located, has just opened its dialysis center. So congratulations.
Thank you. Thank
Yeah.
you.
And can you share with us more about this, Doc? What does it mean? And who can you guys reach out to, and who can benefit from this?
Yeah, this dialysis unit is catered for hemodialysis, blood dialysis, and we have the purpose is actually we want to help. We want to make sure our kidney uh, failure patients who are located around here at least can benefit and can actually do dialysis, and that can lead them to a normal life as much as possible. And this is definitely a first of a kind in Colombia, Asia. It's a comprehensive kind of a care. We have dedicated doctors, even our HD managers, nurses, and dietitians, and a lot more that we can go through. It's a comprehensive care, and it follows international standards of requirements as for the setups, for the water purification systems and whatnot. So it's a well comprehensible kind of a care, kidney care that we want to offer to our kidney failure patients for them to benefit. Yeah?
Wow, awesome. Sounds wonderful because it is, if you think about it, it's all connected, right? The healthy food, the diet, and stuff like that. And you're able to offer that to the people of Klang. So fantastic. Thank you so much. We wish you all the best in this. And yeah, I hope that everybody who's tuning in, if you found a lot of value from today, please do share it out with your family, with your friends. Don't forget to give us a lot of loves and like, because today has been really important because our kidney is a vital organ. Yeah, right, Doc? Okay, so
Yes.
thank you so much. That's all the time we have. We hope you learned a lot, and definitely follow us on our social media and give us lots of love and like. Until the next time we see you, please do take care of each other, and we'll see you in the next episode. Okay, thanks. Bye.